This is Duncan Turner from the Vagina Doctor podcast. Welcome to the Consult With Me segment where we take a deeper look into our most frequently asked questions. But what do I know? I'm just a vagina doctor.
So this is a call that comes in a lot. And these calls get sent to me to talk to the women. So I like it. But it's always a story of, I haven't had sex in a really long time. Well, how long? 2 or 3 years, sometimes longer. And now I've met someone and I can't do it. It hurts. He was so patient and so nice about it, but I just can't do it. And so I explained to them the procedures that could help them that we have, obviously. And they're like, but how are you going to get it in? How are you going to get that device in my vagina if I don't think I could put anything in there right now? And they're very worried and concerned. So couple things about this. One is, why, if you don't use it, you lose it. It's true. Why is that with our vaginas? And as far as what women can do if they're not using it, so they don't lose it. I want to go into those two things because we all know about the treatments we do that fix this, and they 100% do, and we all know that. But I want to just kind of go into more what's happening there.
What's happening? Yeah. Okay. So really, I mean, our patient population is generally an older population, 50 to 70, and surprising to some people, a lot of these people still want to have sex, and they and it's perfectly reasonable. And we're here to help.
Yeah.
What happens is that usually without estrogen specified for that area, for the pelvis, the tissues will decrease their blood supply, they decrease their collagen, they become less elastic. And so they put something in the vagina, or they try to put something in the vagina that hasn't been there for a while. It can be really uncomfortable. So it's just that it hasn't been stretched. And so, and if they had been having intercourse regularly, this is less likely to have happened. But it's often in these patients where they haven't been on hormone replacement therapy or just vaginal estrogen that they have a particular problem. And so in the treatment, we often will use that as a first line of defense. Even if somebody's regularly having intercourse, it can still get more and more uncomfortable as time goes on because of the lack of estrogen. So number one is estrogen is crucial.
The little suppositories or the
creams.
The thing that I've been doing that I really like.
Yeah, the estriol cream.
Yeah, or even the hyaluronic.
And hyaluronic acid, yeah. Right. Lots of things that can help in that regard.
So even if you're not putting, like we have those dilators in the office.
Well, dilators, we don't often need to use dilators, but sometimes we do, and sometimes it's necessary. Mm-hmm. So that's a matter if somebody hasn't had intercourse for a long time, and they try again, and it's just, I had one patient the other day who said, I didn't know I could grow a hymen again. But when it came to it, a gentle examination is usually perfectly possible. And then priming with estrogen, which may take a few weeks, and we don't always wait that long, but then we might use, if we don't think that we're just getting the mucous membranes right or corrected, that's going to be okay, we'll often suggest they use dilators. So we give them a set of dilators, which are plastic tubes. They use a lubricant with them, and they, usually there are about 5 or 6 different sizes in the set. And the first 3 or 4 sizes, there's not a problem. Even though the patient thinks I can't put anything in there, I can't put a tampon in or anything, they will find that the dilators are actually pretty comfortable to use up to a point. and that's the point where the elasticity is gone and it needs to be stretched. So it's putting 3 or 4 of the little ones in doesn't really, I mean, not at the same time, but the smaller ones will get us to a point of being able to use the technology. But I've rarely had, in fact, I can't remember any patient I've had where we've been using any of the vaginal procedures and not being able to use them because of patient discomfort.
Yeah.
But the dilators certainly have a place when somebody has not had intercourse for a long time. So estrogen, dilators, and then often the procedures that we do with laser or radio frequency necessary. But it can happen to anybody at any time if they haven't had intercourse for a while, because everything, if it doesn't get stretched, it's going to just sit in a state where there isn't a lot of blood supply and their estrogen levels may be getting a little lower for one reason. Even people on the birth control pill will have low estrogen levels, so they can have pain with intercourse also, particularly if they haven't had it for a long time. But the common story is exactly as you described. They haven't had intercourse for a significant period of time. It's a new partner, usually in those circumstances, and they're horrified because it can't happen.
Yeah.
Great thing is we can solve the problem for these patients.
Yeah. How soon after the treatments are they able to have sex without pain?
They can have tolerable sex within a month. So slightly uncomfortable and manageable, but not fun. And usually within 2 months, it's going to be fine. It's going to work. And there are often other symptoms that go along with that lack of use, which are urinary symptoms, but that's not what the question was today.
Yeah.
Thank you.
Great. Thanks. Thanks for listening. And if you have more questions, please let us know either by email or DM us on the Vagina Doctor podcast.
See you in the next episode. The Vagina Doctor podcast. It all starts here.